Hey folks, this is part 2 of how to program your flexibility. In part 1 we discussed static holds, working with your proprioceptors, getting them to relax so that you can go into a nice static hold and effectively reset the length of that specific muscle tissue. This video we're going to be adding a layer to that, a little more of advanced technique. Specifically we're going to be talking about PNFs, which stand for proprioceptive neuromuscular facilitation. Some of you have experienced in my sessions a form of that. Yes, some of you have experienced within your massage sessions me doing something that's very similar to PNF. It's called METs. It's what I was trained in. It's muscular energy technique. There are subtle differences, and one of the main things is you really need to have a therapist do it on you. And PNFs started in the clinical setting. Physical therapists do them quite often. It's a very effective tool for increasing the functionality of a specific muscle. You can do it on pretty much any muscle, but you can also do it on yourself, and that's why we're discussing PNFs, so that you can incorporate it within your stretching routines. There are many types of PNF techniques. We're going to be discussing just one, however, and that's the contract and relax mode. It's very simple to incorporate within the stretch, and there's not only is it going to increase your flexibility within that muscle, increase the range of motion, but it's also going to induce an element of strength conditioning because it's a contraction. It's usually isometric contraction. So again, it's a very effective tool. Basically, both METs and PNFs are attempting to create a window where the proprioceptor is vulnerable for reprogramming. And this is done very easily with introducing a contraction. When you're contracting the muscle, you're abruptly switching on the proprioceptor. You're also recruiting muscle fibers, so you're inducing a load. And then when you relax, and incidentally, the contraction for these PNFs, there's not a full contraction. It's roughly about 50% of your power. Really like 30 to 50% of your power. You don't have to go your full force, but you want to hold it about 5-6 seconds, and then you let go and you go into relax, and then you push the boundary. You hold it there for a few seconds, contract again, hold it 5 to 6 seconds, let it go, push the boundary again, and you do it 3 times. So there's that window when you're in that relaxed mode. And remember, in the first video we discussed how important it is that the muscle you're attempting to stretch is completely relaxed. Well, this really induces that relaxed mode quite effectively and quickly. When you're firing the muscles and then you shut the contraction off, you introduce a fatigue factor. So the muscles are on, and you let go, and so they really are relaxed, and that allows you to push that boundary. And also the proprioceptor is shut off. So there's that window that I was talking about. And that's what makes these techniques very effective, is that window, and the timing is important. And let me demonstrate so we can get a better idea of what I'm talking about, okay? So let's use the hip flexor stretch, since I put a video out on how to do this in order to demonstrate this technique. Remember, you can do this technique in pretty much any stretch, okay? So we're stretching the hip flexor and the quad muscles. My knee is into the floor. So I'm going to use the floor as my resistance for the isometric hold. You can just contract the muscle, but it's better to have form of resistance. You're going to get a better contraction. So I'm using the floor. I'm going to be pushing my knee into the floor to create the contraction. Now again, it's not full force, 30 to 50% of my power, okay? And the reason I didn't put these technique here in the first video is because it's very important that you're comfortable and in somewhat conditioned before you incorporate these techniques. Because you're introducing a contraction, there is a chance you can hurt yourself. So make sure you do not incorporate into any of your stretches until you're comfortable with that stretch and you have increased the flexibility already somewhat within that muscle fiber. Do not go straight off the bat into PNFs. We want to be safe as possible, and that's the reason I waited and held back before putting this video out. in attempt to, you guys not to hurt yourself. So again, it's an advanced level of stretching, very effective, but there is a chance you can hurt yourself if you go straight into it. You're stiff, you're not used to stretching, you're not comfortable in your stance, your range of motion is funky, and you start contracting, and so be safe. Okay, so here I go. I'm in the stretch. I'm going to introduce the contraction. I'm pushing my knee into the ground. 1, 2, 3, 4, 5. Relax for a beat, and push that boundary a little and hold it there. 2, 3, 4. Contract. 1, 2, 3, 4, 5. Let it go for a beat and push. 2, 3, 4. Contract. 2, 3, 4, 5. Relax and push. And then I'm going to hold. Okay, make sure you come out slowly. So the timing that I used just now was a 5-second holding the contraction. I let it go, and then I took maybe 1 second. The reason for that, there's the window there. Some people do this technique, they contract and they release and they go into the push. I like to wait a little bit, just maybe even a half a second, just enough for the muscles to totally relax. If you go too fast, there's still some muscles that are fired up. Your proprioceptor that window has not yet been created. That's why the timing is important. With the METs, it's even more crucial. That timing is even longer. So you want to let go of the contraction and wait a beat so that you're totally relaxed, and then push. You don't want to wait too long, but you definitely want to make sure that you're relaxed, and then you push and hold. So it's about a second hold, no more than a second hold, and then you push, and then you hold that position for about 4 seconds. Get a good feel, a good stretch. Boom, incorporate the next contraction, 5-second hold, let it go, push. Hold that 4 to 5 seconds, contract, hold for 5 seconds, let it go, push, and hold at the end. Be very gentle. You don't have to push too hard. Be comfortable within that boundary pushing. You're going to increase it each time. So if you're doing it 3 times, you don't have to go from here to there. You're going to get there in 3 times. We don't want to cause any kind of injury, so we just want to work within a comfortable boundary. By resetting that proprioceptor, remember the proprioceptor holds the programming for the length of that muscle that you're stretching. So that's what we're working with. That's the attempt of these techniques. It's not about aggressively stretching the muscle. It's just we're trying to reset the length of that tissue. There's your PNF, folks. Any questions or comments, you can leave them here on the video or reach out to me personally. If any of this stuff isn't clear, please do not hesitate to reach out and ask me questions. It is an advanced form of stretching. So again, I want you guys to be safe. If any of this video or any of the other videos is of value to you, I'd appreciate letting me know by hitting the like button. Also, I'm going to be doing at least 1 or 2 of these a month, so you may want to subscribe so you can get them as they come out. All right, folks, thanks, and we'll see you soon. Can you guys just keep it down just a little bit? Just a little bit? That's not down. That's not quiet. Use your inside voice, please. Ow. They're very similar. What's with my light? Why does the light keep going out?